Drugs of choice during pregnancy. Disease-specific Q&A guide cardiovascular conditions. Question: what is the safest antihypertensive drug for chronic hypertension in pregnancy? A. Methyldopa is considered first line for chronic hypertension due to its long safety record. Labetalol and nifedipine, extended release, are also safe alternatives. Avoid ACE inhibitors, ARBs, and atenolol. Question: what medication should be used for severe preeclampsia/eclampsia? A. Magnesium sulfate is the drug of choice for seizure prophylaxis and treatment in preeclampsia/eclampsia. For acute severe hypertension, use for labetalol or for hydralazine. Question: which anticoagulant is safe during pregnancy? A. Low molecular weight heparin, LMWH, such as enoxaparin, is preferred. Unfractionated heparin is also safe. Warfarin is contraindicated in the first trimester and late third trimester due to teratogenic effects and bleeding risk. Infectious diseases. Question: what antibiotics are safe for urinary tract infections during pregnancy? A. Nitrofurantoin, avoid in first trimester and at term. Amoxicillin and cephalexin are safe choices. Avoid fluoroquinolones, tetracyclines, and sulfonamides near term. Question: which antibiotic should be used for Group B streptococcus prophylaxis? A. Penicillin G4 is first line. For penicillin allergic patients, cefazolin, if not severe allergy, clindamycin, or vancomycin depending on sensitivity and allergy severity. Question: what is the treatment for bacterial vaginosis in pregnancy? A. Metronidazole, oral or vaginal, or clindamycin, oral or vaginal, are both effective and safe. Treatment reduces risk of preterm birth. Question: which antiviral is used for herpes simplex virus during pregnancy? A. Acyclovir is the drug of choice. Valacyclovir is also safe. Suppressive therapy from 36 weeks until delivery reduces transmission risk and need for cesarean delivery. Question: what antimalarial drugs are safe in pregnancy? A. Chloroquine and hydroxychloroquine are safe throughout pregnancy. For falciparum malaria, quinine plus clindamycin is used. Artemisinin-based combinations may be used in second and third trimesters. Respiratory conditions. Question: which asthma medications are safe during pregnancy? A. Inhaled beta-2 agonists, albuterol, and inhaled corticosteroids, budesonide is preferred, are safe and essential for asthma control. Well-controlled asthma is safer than uncontrolled asthma. Question: what cough suppressants can be used in pregnancy? A. Dextromethorphan is considered safe. Guaifenesin for expectorant needs is also acceptable. Avoid codeine in first trimester and near delivery. Question: which antihistamine is safest for allergic rhinitis? A. Loratadine and cetirizine are preferred second-generation antihistamines. Chlorpheniramine is also safe but may cause drowsiness. Gastrointestinal disorders. Question: what is the first-line treatment for nausea and vomiting in pregnancy? A. Start with vitamin B6, pyridoxine, alone or combined with doxylamine. If inadequate, add ondansetron or metoclopramide. For severe hyperemesis, consider promethazine or chlorpromazine. Question: which antacids are safe for heartburn during pregnancy? A. Calcium carbonate TUMS and magnesium hydroxide are first line. H2 blockers, ranitidine alternatives like famotidine, and proton pump inhibitors, omeprazole, lansoprazole, are safe if needed. Question: what laxative should be used for constipation? A. Bulk-forming agents, psyllium, methylcellulose, are first line. Docusate sodium and polyethylene glycol are also safe. Avoid stimulant laxatives like senna in first trimester if possible. Endocrine disorders. Question: what is the insulin of choice for gestational diabetes? A. Regular insulin and NPH insulin are traditional choices. Rapid-acting analogs, Lispro, Aspart, are also safe. Avoid oral hypoglycemics except metformin, which is increasingly used though insulin remains preferred. Question: which medication treats hypothyroidism in pregnancy? A. Levothyroxine is safe and essential. Thyroid hormone requirements typically increase by 25 to 50% during pregnancy, requiring dose adjustments and monitoring. Question: what drug is used for hyperthyroidism during pregnancy? A. Propylthiouracil, PTU, is preferred in the first trimester. Methimazole can be used in second and third trimesters. Both cross the placenta but are necessary to prevent maternal and fetal complications.
Drugs of choice in pregnant psychiatric conditions question: which antidepressant is safest during pregnancy? SSRIs are commonly used, with sertraline and citalopram having the most safety data. Avoid paroxetine in first trimester. Untreated depression poses significant risks, so benefits typically outweigh risks. Question: what mood stabilizer can be used for bipolar disorder? Lamotrigine is preferred if possible. Avoid valproate, high teratogenic risk, and carbamazepine. Lithium carries some risk but may be necessary. Requires careful monitoring. Question: which anxiolytic is safest for anxiety disorders? SSRIs, sertraline, citalopram, are first line for anxiety. Benzodiazepines should be avoided if possible, but if necessary, short-term use of lorazepam or clonazepam may be considered with caution. Neurological conditions question: what is the safest anticonvulsant during pregnancy? Lamotrigine and levetiracetam have favorable safety profiles. Avoid valproate, highest teratogenic risk, and phenytoin. Seizure control is critical, so medication continuation is usually necessary. Question: which medication treats migraine during pregnancy? Acetaminophen is first line for acute treatment. If inadequate, metoclopramide or prochlorperazine can help. For prevention, propranolol or amitriptyline may be used. Avoid NSAIDs in third trimester and triptans if possible. Pain management question: what analgesic is safest for pain during pregnancy? Acetaminophen is the safest option throughout pregnancy. NSAIDs, ibuprofen, naproxen, can be used in first and second trimesters but must be avoided after 20 weeks due to fetal complications. Question: can opioids be used for severe pain? A short-term use of opioids, codeine after first trimester, oxycodone, hydrocodone, may be necessary for severe pain. Avoid chronic use due to neonatal abstinence syndrome risk. Use lowest effective dose for shortest duration. Rheumatologic conditions question: which medications are safe for rheumatoid arthritis during pregnancy? Hydroxychloroquine, sulfasalazine, and low-dose prednisone are safe. Avoid methotrexate, highly teratogenic, leflunomide, and most biologics except certolizumab. Question: what can be used for systemic lupus erythematosus, SLE? A hydroxychloroquine should be continued. Azathioprine and corticosteroids are safe. Avoid mycophenolate and cyclophosphamide. Dermatological conditions question: what topical treatments are safe for acne? Topical erythromycin, azelaic acid, and benzoyl peroxide are safe. Avoid topical retinoids, tretinoin, adapalene. Oral antibiotics like azithromycin may be used if needed. Never use isotretinoin, highly teratogenic. Question: which medication treats eczema during pregnancy? Low to moderate potency topical corticosteroids are safe. Emollients and moisturizers should be used liberally. Topical calcineurin inhibitors may be used with caution. Important general principles: always consult healthcare providers before starting, stopping, or changing medications during pregnancy. Benefits versus risks. Many conditions pose greater risks when untreated than the medications used to treat them. Timing matters. Some drugs are safer in certain trimesters. Folic acid supplementation, 400 to 800 micrograms daily, should be taken by all pregnant women. FDA pregnancy categories have been replaced with more detailed labeling, but Category A drugs, proven safe, are rarely available. Disclaimer: this guide is for educational purposes only. All medication decisions during pregnancy should be made in consultation with qualified healthcare providers who can assess individual circumstances, current evidence, and specific risk-benefit profiles. Thanks for watching a video created by PharmacistRx. Stay happy, healthy, and safe.